Good morning. Thank you so much for inviting me here today to share with you the findings of an evidence review which myself and Steve Milton of Innovations in Dementia, who isn't with us today, were asked to do by the EU Joint Action on Dementia. Steve and I have, as Helen mentioned, in the last year been working on a number of projects which have asked the question, what works in relation to dementia-friendly communities? So alongside the EU evidence review, we've also been working on the guide that Helen mentioned for Alzheimer Society England, and also on the evaluation of a local dementia-friendly community initiative in Wigan in the north of England. Dementia-friendly communities are very much in their infancy in many European countries, and even where there has been a lot of activity, the published research evidence base is still at an early stage. So when we were asked to review the evidence, we decided it was going to be really important to supplement the formal evaluation evidence with lots of conversations with people with lived experience and also people with practice experience. We held group discussions with people with dementia, including those from the European Working Group of People with Dementia. And we conducted interviews and we ran an online survey with a range of people involved in developing dementia-friendly communities across Europe. Today, I'd like to share with you the definition of dementia-friendly communities, which Steve and I have proposed as a result of that evidence review, and I'd like to explain some of its key features to you. I'd like to consider some of the recurring themes which arose from our conversations with people with dementia about what makes a community dementia-friendly. And I'd like to share our proposed model of dementia-friendly communities, which we hope will be of use both to those starting new and those reviewing existing initiatives. Firstly, a few words about, it's not going to click on, is it? If I could just click on to the next slide, thank you. Firstly, just a few words about the joint action. The joint action, as many of you will know, aims to promote the implementation of coordinated actions across Europe to improve the lives of those living with dementia and their carers. Work Package 7, which is led by the UK government in partnership with Bulgaria and Greece, aims to provide EU member states with clear, evidence-based and tested information and recommendations on how to effect change and improvement in supporting people with dementia to live at home through the development of dementia-friendly communities. If you could click on, please. Our review is the first step in this process, which will also include the development of a toolkit and a series of pilots to test best practice models. On to the next, please. So, first of all, thank you, that's great, cheers. So, first of all, what do we mean by a dementia-friendly community? Oh, no. I'm going in the right direction, brilliant, we have control. So, Steve and I have suggested the following definition. In a dementia-friendly community, people with dementia are included and respected. Citizens, organisations and businesses work together to remove the barriers which stop people with dementia and their supporters from participating in community life. I'd like to highlight a few features of this statement. First of all, the inclusion of people with dementia, both in the community itself and in the work to make it more accessible, is absolutely critical. Secondly, citizens, organisations and businesses. Note the breadth of this alliance. Whilst health and social care providers are important allies, the aim here is to mobilise ordinary people, both those personally affected by dementia and not, and wider organisations and businesses. Thirdly, the focus is on removing barriers. You will note that this is the language of the social model of disability. The key question is, how can we make society more accessible to people with dementia? It's also about supporters of people with dementia, whether they be family, partners or friends, who, as we've heard so powerfully from Jane and Chris, face barriers and challenges in their own right. The focus should be on participation in community life. This is not to say that peer groups and activities and services which exclusively target people with dementia and their carers do not have an important part to play. But the ultimate aim is to promote participation in ordinary day-to-day life, integration between people who have dementia and those who do not, and to remove barriers from mainstream, not just dementia specialist organisations. We argue that the priorities and actions should be locally determined because they need to grow from the particular challenges faced by people with dementia in that particular area, and they need to build on the assets and resources available to the Alliance. Dementia-friendly communities should ideally be locally based, ground-up social movements. And that's not to say, however, that national and regional bodies don't have a really key role to play in nurturing, supporting, joining up and sustaining those local initiatives. Of course, each person with dementia will have different interests, priorities, experiences and resources, but some common themes and barriers emerge from our conversations and from previous research. Firstly, the importance of relationships and social interactions with others in the community comes out as a key priority for people with dementia. Given both the nature of the condition and the stigma and lack of awareness surrounding it, this is where people tend to report the greatest barriers to participation. Here are a couple of examples of this from people with dementia in our group discussions. If people start talking at you fast, you can't tell them. It just doesn't go in. It goes over the top. And if you slow down to talk to them, they get cross with you because you're delaying somebody else. I often pull back from conversations with people because I'm worried about forgetting the words or it just being too difficult. The accessibility of the physical environment emerges as the next priority, and we're including under this very broad heading physical places, signage, layout, flooring, mirrors, etc. Systems, automated and phone-based systems, which people often told us they found extremely confusing and stressful. And information, we've already heard about how the speed and amount of language can be challenging for some people. And the use of jargon was also mentioned as having a particular impact on some people with dementia. The following quotes illustrate the first of these points in relation to physical places. Coming out of these toilets, I didn't know whether to turn right or left. There's no sign saying back to where you came from. And I would like all shops to have carpets that are not black. I skirt around them. Finally, some recurring themes about the rights of people with dementia and their role in their lives of their communities. The importance of continuing to be me, as Chris so eloquently put it, to as far as possible do the things you've always done, emerges time and time again and is for me the real driver to promote dementia-friendly communities. People with dementia want to be able to go out for a drink, go for a swim, watch a football match, go to the theatre. They don't just want to go to services for people with dementia. We went to meet with some people with dementia and their partners in Rothwell in the north of England who come together weekly at their local pub to drink and share information, ideas and just have a chat and a laugh together. Being able to make a contribution is at least as important as it has always been. Being able to help other people with dementia and to improve services and policies around dementia, but also to do things that aren't related to dementia at all, whether it's arranging flowers for your church or picking up a newspaper for a neighbour who is unable to walk to the shops. In Apeldoorn, in the Netherlands, for example, the Demen Talent Project has worked with volunteers with dementia to clear scrubland, maintain woodlands and buildings. Finally, the mantra which we've already heard today of nothing about us without us. Initiatives to make dementia communities more dementia-friendly have ironically not always been that inclusive themselves. Yet the evidence we gathered and reviewed suggests that the involvement of people with dementia is essential if these initiatives are to genuinely break down barriers, challenge stigma and make real improvements to the lives of people with dementia. In Scotland, for example, a group of people with dementia called the Pioneer Group developed key pieces of advice for the general public in their interactions with people with dementia. And these were used in a poster campaign for a dementia-friendly Edinburgh. Just like to share a quote here about making a contribution. I can contribute in other ways to my community. My life is not just around dementia. Stay involved with things you were involved with before dementia. So what, based on the published, practiced and lived experience evidence that we reviewed, emerge as the key steps, processes and structures in setting up a DFC initiative? At the heart of any initiative, there needs to be an alliance. We've called it on the slide a Dementia Action Alliance, but we recognise there are lots of other terms in use in other countries. In Germany here, for example, there's a growing network of dementia alliances. One person we interviewed described an alliance as a coalition of the willing. And whilst I could reel off a few core stakeholders who should ideally be round the table, it's often the unexpected members who have the most to bring: the cafe owner, the park keeper, the people who run the golf club. The dementia alliances in Germany, for example, bring together those who represent many different aspects of community life: cultural activity, musical activity, as well as very ordinary day-to-day aspects, going to the shops, using public transport, using public services. As we've already highlighted, it's really crucial to make sure that people with dementia are involved at the very start and throughout, identifying priorities, auditing places and spaces, reviewing the accessibility of websites and leaflets, co-producing awareness-raising materials and publicity. Where people with dementia play an active role in a dementia-friendly community initiative, it sends out clear messages to challenge the idea that people with dementia can't do things, that they are people who are just done to. I've already touched on some of the values which should be implicit in dementia-friendly community initiatives. If we're to develop initiatives which promote the inclusion and active citizenship of people with dementia, rather than, albeit inadvertently, further segregating and patronising them, it's really important to articulate a hopefully shared set of values from the outset. Basing dementia-friendly communities on rights rather than on friendliness alone should help to promote the equality of people with dementia, rather than reinforce paternalistic images of them as people who need to be helped. Depending on the legal framework in your country, this may also ensure greater sustainability. Businesses and services will, in many parts of the EU, have a duty to improve access to people with disabilities, including dementia, not just the option to be friendly to them. We've already touched on the importance of mainstreaming as both a value and an aim. By mainstreaming, we mean firstly trying to remove barriers to ordinary services. So it might be a great idea to run a weekly dementia-friendly swimming session at the local pool, but it's also really important to make sure that staff are trained up and that simple changes are made to signage and layout so that people with dementia are welcomed and supported to attend the swimming pool at other times of the week too. As part of the side-by-side project run by the Alzheimer Society in England, people with dementia are matched up with a volunteer buddy who will go along with them to help them continue doing the things they want to do in their communities. Seeking to build actions and changes into ongoing plans and strategies is also a key part of mainstreaming. So dementia awareness raising sessions might be part of the training which taxi drivers have to undertake to receive their licence, or a core requirement of dentists training, not just a one-off initiative. Being asset-based means building on the strengths and resources of people with dementia and the Alliance and the local area. Such an approach uses existing community hubs, places where local people already come together, might be the pub that we mentioned earlier, and engages people in the community who are already well connected. For example, those promoting dementia-friendly communities in Wicklow in Ireland recognised that there were already community ambassadors going out and connecting with isolated older people in the area. It made sense to train those workers up in relation to dementia and partner with them to achieve the goals of the dementia-friendly community, rather than start all over again with new ambassadors who didn't yet have the trust of local communities. In Luren, Norway, the dementia-friendly community work built on the existing networks and relationships which had been forged through conversational support groups already being provided in the town for people with dementia by health professionals. Over to the right of our diagram, we've listed some of the key steps which dementia-friendly community initiatives should take in their planning. They need to identify local assets, agree local priorities, highlight any obstacles, and plan evaluation. How will they know if what they are doing is working? And ongoing marketing and communications is crucial. Areas of action, as we've said, should emerge from local priorities, networks and assets. However, the following list adds the following useful checklist of different categories, and I'll mention just a few. So arts, leisure and recreation. In England, the West Yorkshire Playhouse has sought the advice of people with dementia to create dementia-friendly theatre performances. Shops and businesses, children and young people, faith and community groups, emergency responders, police, fire and ambulance. For example, as part of the work to create a dementia-friendly abbiatigrasso in northern Italy, police officers have received training covering a basic awareness of dementia and tips and tools for communicating with people with dementia. Health and social care. A key question here is whether mainstream provision, not just memory services, are accessible, from dentists to opticians to the layout of hospitals and doctors' surgeries. Housing is vital, and finally transport. So the largest bus operator in the Netherlands has been working with Alzheimer Nederland to train their staff to recognise and help customers with dementia in a friendly and appropriate way. Across each of these areas of activity, it's important to consider the following. Place. How accessible are the buildings, public spaces and written information to people with dementia? The people. Are there opportunities for raising awareness and for sector-specific training? Networks. How do organisations and services work together with others to support people with dementia? Resources. How can resources be focused in a way that increases the accessibility of mainstream services for people with dementia, that builds resilience and promotes a community-based response? And running through each of these, as you will see from the diagram, the voices of people with dementia and their supporters. How are they involved and heard? In the words of one of the people with dementia who contributed to our review, quote, "What I require from society is an open mind, for people to be prepared to listen to my story, not just to read from books. We are also experts." Thank you so much for your time and attention.